So, are you ready, Bernard?
Yeah, I'm ready. I can go ahead and start.
Okay, you can start.
Alrighty. Okay, guys. So the name of the paper that I'm presenting on today is called "The Effects of Virtual Reality Augmented Robot Assisted Gait Training on Dual Task Performance and Functional Measures in Chronic Stroke, a randomized control single blind trial." So a little bit of background. People who have stroke typically they're limited in multiple things. One of those being that they're limited in our daily activity just due to having to perform dual task activities. Specifically, when we're walking, when we walk, we're walking and talking. Maybe we're walking with our phones or walking and having to react to different stimuli in the environment. So, when it comes to stroke, they may be limited due to their physical abilities, or they're limited cognitively. They're not able to sort of think and react to those stimuli. So this is where training them to train their motor and cognitive abilities is very important when it comes to our stroke rehabilitation. And so there's been multiple studies that have looked at VR and robot assisted gait training approaches to improve both of those factors. First, with virtual reality, is shown to improve neuroplasticity and then increase movement quality. Neuroplasticity, specifically being when it comes to the cognitive functioning, and then increased movement quality, just as far as bettering their mobility. Then robot assistant gait training, which I'll be kind of abbreviating to RAGT, is shown to improve their gait and balance. And so, what this study determined to do was to try to find a way, or trying to see what the effect was when you combine both those treatments, and then that ability to perform a dual task performance and the effect of their ability to do that. And then they also went to look at the effects of combining those treatments on a functional measure. So with things like when it comes to gait or mobility or balance or that fear of falling, and then ultimately their independence level after that training. So the way the study was designed was they took 30 chronic stroke patients aged between 40 and 65 from a rehabilitative facility, and they randomly divided them into two groups. That first group being that combined treatment, the VR and RAGT study group, and then the control group was just the group that only received robot assisted gait training. And so the methods, when it comes down, what they did before they started any of the training or any of the treatment, they first provide a baseline assessment for each group. So they evaluate their cognitive state, their ambulation ability, their dual task performance. And their dual task performance kind of came down to them being able to walk and then respond to different things. So they had them first walk just on their own, just normal walking. Then they had them walk while completing another motor task. So they had them walk while holding a cup of water in their non-affected hand. Then they had them do walking while responding to a cognitive stimuli, where they had them walk, then respond to something that the therapist said by responding yes or no. So that was a dual task performance, and then they evaluated their mobility, their balance. They took a fear of falling assessment, and then they took an evaluation of their ability to complete ADLs. So both the study group and the control group participated for 6 weeks with 2 sessions per week. That study group participated in the RIGT, which helped the patient follow a typical gait pattern at a constant speed and a standard weight of support. So they basically had the patient walk at a normal speed, and then also they had the patient weight bear 50% of what their normal body weight was. Then while they did that, they simultaneously played a VR game on the screen in front of them. So this VR game had them kind of navigate themselves through a forest where they kind of avoided trees by weight shifting to their left to go left, or weight shifting to the right to go right, to avoid those trees, and also to pick up coins on the ground. That's kind of like an objective or a goal. And then that control group also participated, like I said, in that 6 week trial, but they only did the robot assisted gait training, where they had that typical gait pattern at a constant speed, and then at the same standard weight support. And then along with those two treatments, or whichever treatment that they were assigned to, They also received a specific neurodevelopment treatment program that just kind of catered to whatever neurodevelopment problems that they had. And then at the end of the 6-week trial, they are reassessed for the kind of like their functional abilities. They reassessed them with those those factors that I stated before. So here's just kind of like a picture of what the training looked like, specifically that study group. So you can kind of see them in this kind of little contraptment. This is that robot assisted gait training. They have this treadmill sort of thing under them where they walk, and then they weight shifted to their left or right. Of course, this robot helped them kind of ambulate normally and kind of perform a standard gait pattern. And then that screen in front of them, you can see on this right side is what they kind of saw. So you kind of see they're in the forest trying to navigate their way around trees that kind of were in front of them. So the results were pretty interesting. They're also pretty simple. So essentially, the patients improved in all functional abilities, regardless of their treatment they received. So whether they received the combined treatment or if they received just the robot assisted gait treatment, they improved in all functional abilities. But when you compare the groups, the only significant difference was seen when it came to cognitive dual task performance, and that was actually in favor of the control group, not even of the study group. So there's no significant difference seen in any other functional tasks, whether that was gait or balance or anything like that between the two groups. So when it comes down to it, both treatments seem to be a viable option. They have similar effects on improving functional measurements, which is interesting because the whole reason why they went to do VR was to kind of bring in that to improve that cognitive functional ability. So the reason they decided to do VR in the first place was what VR allows for is for repetitive dual tasks by providing sensory feedback to improve cognitive function. So we know as we're in our daily lives, we're not normally when we're doing things, we're not just only doing one motor task. We're not just reaching out to get something. We're thinking about how to move ourselves around that object, or when we're walking, we're not just thinking about just walking in a straight line. Where we're thinking about how to react to certain stimuli. We're on our phone, we're talking to somebody, we're responding to something. And so that's where VR comes into place. And then there's also studies that show that focusing on more than one task can help prevent the fear of falling. And that's something that's very prevalent in stroke patients. After they've undergone a stroke, they are very fearful of falling because their physical ability, they're probably very weak on one side or the other. Something that was also very interesting was that there were lower baseline scores in the study group than the control group. And this could have contributed to not seeing significant difference between the groups because the control group started at a higher functional level. This kind of put them at a higher standard, and they probably wouldn't have seen significant difference between that control group and the study group. So to kind of conclude, I don't think this study provides decent evidence on and what combined treatment can do for people who undergo stroke. This combined treatment is viable. It's important for being able to train patients and improving their multi and cognitive multitasking, or motor and cognitive multitasking. And this all comes back to relating it to daily living. There are a couple limitations that were in the trial. One of the first ones being that the treatment period only lasts for 6 weeks. It would have been very interesting to see what it would have looked like had they performed the treatment for, say, half a year or 6 months to a whole year, to see if there could have been a significant difference between the two groups, if there was a longer treatment trial or training trial. The second is that they were still unable to determine if the lack of significance between the two groups was due to the baseline scores, since that control group was at a higher functional level than the study group, or if it was actually due to the VR effect. VR played no role in increasing cognitive or motor functioning. And then the last was that there are limited components of measuring cognitive skill. Like I talked about, the way they measured cognitive skill was they had the patients walk, and then they basically responded to something that the therapist said. So while walking, the therapist said yes, they responded. I think if the therapist said yes, they responded no. or I'm sorry, the therapist said red, they responded, the patient responded no, but the therapist said blue, their patient responded yes. And so this is only one type of cognitive skill that they show, which is like kind of like a verbal skill, but there's multiple others where it's like um, verbal memory or just uh, other types of memory, or that could be like numerical functions where they can respond to some sort of math equation while walking, or some type of spatial perception or language or executive function is something that they could have gone into, but they didn't. So I guess later studies will kind of look into that and then try to kind of see um, or discuss and talk about these limitations. But like I said, combined treatment or even just robot assisted gait training are two viable options, or that are viable to use with patients that have stroke and to sort of enhance their motor and cognitive abilities after undergoing traumatic injury like a stroke. And this all kind of boils back down to improving their daily living and then getting them back to how they were living before their stroke. So that's all I have. I'm not sure if there's any other questions, but yeah, pretty simple study. The only thing that I wish they would have provided some type of graphs. It would have been really cool to see the numbers on a graph, but there wasn't many graphs. It was only kind of tables. But if there's any questions, I'll take any. Hopefully, I can answer them.